Hello, everyone, and welcome. I'm Christina Hawes, Community Engagement Coordinator for the Community Outreach and Engagement Office of Wilmot Cancer Institute. I'd like to welcome you to today's webinar, The Facts About Cannabis as Cancer Supportive Care. This webinar is a part of our Community Conversation on Cancer series, an educational series designed to inform, educate, and disseminate best practices in cancer research, clinical care, and community engagement. It is sponsored by the Office of Community Outreach and Engagement, CERTEC, and the Community Cancer Action Council, or CCAC. This live event has been approved for one AMA PRA Category 1 credit, one CNE credit for nurses, and one contact hour for social workers. If you would like to receive credit for attending, make sure to fill out the post survey. Our presentation today will be followed by a facilitated Q&A session. Throughout the presentation, please feel free to enter any questions in the Q&A box located at the bottom of your screen. We have a lot of ground to cover today, so let me quickly introduce our speakers and get us started. First, we have Dr. Luke Peppone, an Associate Professor of Surgery and Supportive Care in Cancer at URMC. He has a PhD in Epidemiology and Community from SUNY Buffalo and a Master's in Public Health from the University of Rochester. His research focuses on nutritional supplementation and exercise to treat symptoms and side effects of cancer and its related treatment. Next, we have Jonathan Chaffee, the Reality Check Coordinator for Tobacco-Free Chautauqua, Cattaraugus, and Allegheny counties. I'm going to let him talk to you a little bit more about what he does specifically in our Southern Tier region. We'd like to get started quickly. Please make sure to answer your question or put in your questions at the Q&A box, and I'm going to hand it over now to Dr. Peppone.
Thank you very much, Christina. I appreciate the very kind introduction. So I'm going to have some slides and go over the role of cannabis and supportive care in cancer or in how it can help cancer patients. So I wanted to just go over a little bit about the New York State medical marijuana law and how it works right now. It was about 11 years ago, it was over 11 years ago that medical marijuana was signed into law. And it's for all residents or anyone being treated medically in New York State. You had to meet a qualifying condition and originally had to reach a 60-day supply. The medical conditions originally were pretty strict, and now they've loosened up a little bit more. But as you can see, cancer, HIV, ALS, Lou Gehrig's disease, Parkinson, those are some pretty severe conditions that you would need. There were some symptoms that qualified you, such as cachexia or wasting, chronic pain syndrome, and nerve pain neuropathy. Those are some of them. And since then, the program has expanded to include many more conditions now. And quite a few people fit under the qualifying conditions. So originally also, they only had a limited amount of products, and over that, they have expanded the products available. So available it is, as you guys have a lot of seen, those vape pens. It's available in capsule and tablet form. There's oral solutions, there's tinctures, there's sprays, there's lozenges. There's flower or plant material that comes already pre-ground. There's unground flower, and there's even transdermal patches, and I believe you can buy seeds also. So that's the medical requirements, but coupled with that is the recreational cannabis law, and that went into effect, within the past 5 years, and you've really only seen the stores recently pop up. Okay, so that says any adult 21 or older may possess or use cannabis. They can have up to 3 ounces outside their home, 5 pounds inside their home, under 1 ounce of concentrate. You're also allowed to home cultivate a certain amount of plants. And of course, the retail sales are strictly overseen and licensed by the Office of Cannabis Management in New York State. Where can you use it? Well, it's right now it's the similar rules as tobacco, not in cars, schools, public places, stuff like that. And there is local control where municipalities were able to opt out of selling. Okay, so it is remember that federal law, it's still Schedule 1, so technically it's still illegal. So it's legal within the state, but you really don't want to bring it outside of state. And again, that's sort of a legal issue. We're not really going to get too much into that. So you're sitting here and you're wondering, and you're a cancer patient, well, do I need my medical certification? And I would say yes. And what are the benefits? Why choose medical cannabis over recreational? Well, you pay a lower amount of taxes and you get a higher range of products in different potency profiles. So you're paying less and you get a wider range of products, some more suitable for medical conditions as opposed to recreational. You also now are allowed up to a 60-day supply. You can get that delivered to your home too as a medical patient. Obviously, you get better oversight. Each medical dispensary employs a New York State licensed pharmacist. Okay. And you also have enhanced legal protections under New York State law since it's a medical use. But lastly, the biggest thing I would say is you have enhanced safety testing. Okay. So all medical marijuana and recreational marijuana in New York State undergoes testing for microorganisms, heavy metals, pesticides, and basically fungus is the biggest concern. Okay. Now, the medical products have a very strict limit as to what can go in there. So it's a much safer product for those who have medical issues, especially those in the cancer community who may or may not be immunocompromised. And these labs have to be accredited by New York State, and they do follow a very high standard. So I can say the testing in New York State for all cannabis is very good, and the medical testing is superior to the recreational testing. Okay, so what do we really know? What's our research? What is the evidence we actually have, right? Everyone's heard of cannabis for this or that, but what actual medical evidence do we have? Well, we don't have a ton of randomized controlled trials. Recently, we've seen some calls for grants, but that'll at least be 2 or 3 years until those grants are complete and we start seeing those results. So, just a brief history of cannabis research in the United States. The Marijuana Tax Act was enacted in 1937, which essentially criminalized cannabis. And then in 1970, with the Controlled Substances Act, cannabis was put into Schedule 1 category, which means there was no accepted medical use. Um, Along those times in the late 70s and 80s, folks might not know, but a slew of states conducted clinical trials where they tested cannabis cigarettes versus Marinol, which is synthetic THC, the psychoactive chemical in cannabis. So the Marinol is just a capsule with just the THC itself. So these states tested it for cancer patients and glaucoma patients and they found that cannabis worked very well for chemotherapy-induced nausea and vomiting, better than the Marinol. However, they didn't really publish these results. What they did is they showed the results for the Marinol, the synthetic THC, and that was granted approval by the FDA in 1985 and is still available today. It was really the 90s and 1996 when California legalized medical cannabis that we really saw cannabis research change for benefits, right? So we saw benefits in pain, appetite stimulation, muscle spasticity. And around 2010, now you start to see mainstream research. Sativex it's a THC CBD spray has been studied. The Epilodex has an FDA approval, and there's ongoing other trials for other cannabis formulations, some of which will be FDA approved. So, what do we know? What's the safety of cannabis with cancer therapies right now? Well, we actually have quite a bit of experience of cannabis with chemotherapy in the research environment. And we know that there's minimal interactions between the chemotherapy drugs we use and cannabis. We know it's generally safe and it's had very good effects on refractory nausea. And I'll go over one of the more recent studies in a minute. For radiation therapy or some of the hormonal therapies, the data really is limited. It's very limited. There hasn't been any real studies looking at it, but the scant evidence we have, there's no evidence of harm or any interaction with those therapies. And again, we do see patients use it primarily for symptom relief while they're under radiation or hormonal therapy. Now, one of the newer therapies is immunotherapy, and immune checkpoint inhibitors is a type of immunotherapy that's quite common. Okay. So they have raised issues that, we don't know essentially if cannabis is safe with immunotherapy since it might have some immunosuppressive effects. And we saw in early studies showing that cannabis may have a bad effect on survival rates or response rates to the treatment. So actually, we actually have data from our group right here that I'm going to present to you guys and show you guys the newest data on that. So generally, you know, you want to get the medical product of cannabis due to more rigorous safety testing. Um, so when you don't get something that's tested, there is that rare risk of fungal contamination, and that's a real concern amongst cancer patients, not a concern amongst the general population. But in folks that are immunocompromised, it's something that we really got to keep an eye on. Okay. Now, generally safe with the therapies, but older adults, specifically those who don't use it often, need to exercise caution. Okay. And the caution mainly, obviously, when you get your medical license, they go over coexisting psychiatric illness. So I'm not too worried about that. They won't give you your license if you have a coexisting psychiatric illness. What we worry about is dizziness and falls. Okay. And that's generally one of the biggest concerns we have with cannabis. But like I said, the evidence we have is generally safe with the therapies we use now. And I'll get a little bit more into cannabis and immunotherapy. Okay, so first, let me talk about one of the biggest and only actual clinical trials we have on the use of cannabis for nausea and vomiting that has been done within the past 5 years, 10 years, 15 years, doesn't matter. This was published last year in the Journal of Clinical Oncology, a very high impact journal in our field. And this study used took a capsule that was 2.5 milligrams of THC and 2.5 milligrams of CBD. Okay. Now, for those folks who don't know, that's a pretty low dose. Most people aren't really going to feel that, even the psychoactive effects. Some folks are more sensitive could feel it. So they got the THC CBD capsule in addition to the standard antiemetic drugs. Okay. And they were given this pill 3 times a day for the day starting before chemo through day 5 after chemo. That's how long the nausea lasts from chemotherapy, either 96 or 120 hours. And you want to administer the antiemetic before you administer the chemotherapy. So right here, if you look at this study, and here's their table of main results, and down here on the bottom, you can see the highlighted portion. You can see that the maximum number of vomiting per day was cut in more than half for the cannabis group, for the THC CBD group. About half a vomiting episode a day compared to 1.3 in the placebo group. And what we're interested in most is nausea. Okay, so because nausea is much more difficult to treat than vomiting. So if you look here, there was about a 1.5 point difference on a 1 to 10 scale for nausea on their average score. And if you took their worst nausea score, there was about a 2 point difference. And that's a pretty good difference. That's something that a patient is going to notice. Okay, that's something we call clinically significant or clinically meaningful. So right here, we show that if you add a THC oral capsule on top of standard antiemetics, you get significant reductions in both nausea and vomiting and improve that even further. Okay. And again, this is one of the largest trials we have and only trials we have. So this is a very good evidence for clinicians. Okay. So what did we do in our work? Well, I mentioned that we have our own um, line of work, and we have a large group of immunotherapy patients that we followed for a number of years, and that is called the direct cohort, and that is run by my colleague, Dr. Charles Kamen and Dr. Song Yao, and a number of other colleagues. So for this analysis, we had almost 1,700 adults starting immunotherapy or immune checkpoint inhibitor therapy. Okay. They were enrolled between 2022 and 2024. In addition, we got a small grant to measure cannabis use, and we measured cannabis use at the start of their immunotherapy, 6 months after they started, and 12 months. And keep in mind, they could be on their therapy for up to 2 years. Okay. So we also measured their cancer treatment response and their survival, whether or not their cancer worsened or they died or if they're still alive. Okay, so we have patient surveys and we had medical records to do this, and we looked at those who use cannabis and those who don't. So this is just a little flow diagram of the people in our study, and as I mentioned, we had 1,666 people at the start of our study. And within 6 months, we had about 1,140. As you can see over here in this window on the right, we had 526 people drop out, with 228 due to death, 215 had disease progression, and 83 became ineligible. But this just shows the general flow of the study, was starting off with 1,600 through the various time points and follow-ups of the study. So here I draw you to our main results, and I'll tell you what this says. I'll explain this, okay? So we looked at cannabis use, and this is cannabis use, yes or no, and whether or not they were still alive at the end of our study. Now, this number one means that this means exactly 0% risk. Now, these folks had a little bit under one, and that means that those using cannabis were less likely to die during that. Now, if you look at this number over here on the right, this is 1.02 and 1.10. This overlaps with that one. So that means we can't say this number essentially is lower than one with confidence. So we say it's essentially the same. Okay, it's the same. And then if we look at disease progression survival, the difference between those who use cannabis and those who didn't, essentially the same percent right here. Okay. And this is what we're hoping to see, that the effect of cannabis has no impact on immunotherapy, which we strongly believe from the start. Okay, so we looked at cannabis use throughout the entire period of immunotherapy, and we found the exact same thing. Okay, we found that looks like they were less likely to die right here, but again, those confidence intervals are too wide, as we say. And down here, essentially, the same percent had cancer progression, whether or not you use cannabis throughout your period of treatment. This is what we call a survival graph right here. And the more it drops, the more that people have died. The less it drops, the more that everyone's surviving. In green, you can see the line of cannabis users. In yellow, you can see the line of non-cannabis users. And as you can see, we want that green line to be where we told you that green line is slightly higher than the non-users. The users of cannabis are slightly higher. But if you look at this p-value right here, it says 0.068. We look at something and we want to see something less than 0.05. This is above that. So that's why we say these lines, we can't say with confidence that these two lines are different. Essentially, we say these two lines are the same. And then we look at the same graph for event-free survival, and essentially these lines are essentially the same, as you can see. Okay, and that's exactly what I showed you on the numbers. So cannabis use is fairly common. We had about 20% of our patients using cannabis, and that's higher than the general population. The use level stayed about the same. Not many people started, not too many people stopped. It stayed generally static throughout that. And we found no response, no harm response at all. And we found that they lived just as long. In some groups, we found that cannabis use was linked to better survival. But again, these are very small analyses. And we can't really say this with confidence. We need further research. But basically, we are the largest study out there by many fold. And through our study, it does show that cannabis use during immunotherapy appears to be safe and does not reduce treatment effectiveness, which is a key message for clinicians out there who are looking for guidance. So just to finish up, a quick plug on our clinical trial that's starting soon. And this is just a little diagram we call a schema, a study schema. And this shows exactly what patients will be enrolling and what we'll be doing. So we're going to enroll all patients who are starting therapy, chemotherapy, with what we call a moderate or highly emotogenic chemo. Okay. And during that period, we're going to randomize them either to immediately use cannabis or wait one cycle to use cannabis. Okay. And we're working with a local dispensary to do that. Okay, we're going to get 50 adults, as I mentioned. And again, you're either get medical cannabis plus your usual nausea care versus just the usual nausea care for the first cycle. And then the next cycle, everyone gets medical cannabis. So, again, cannabis will be administered for the 4 days each chemotherapy cycle because that's how long the nausea and vomiting lasts. And we have them keep diaries on their nausea levels and what they use. Um, so we also will be checking the safety of cannabis with this. So the type of cannabis we're actually gonna the study I showed you used a capsule, and we're actually going to be using actual medical flower. Now, medical flower is what you usually see in a joint and what people smoke, and we don't want cancer people smoking. It's not good. You're going to hear about that. Okay, and that's 100, and we don't want that, and there's many reasons why. So what we have is we have a vaporizer, okay? And you can see a picture of this portable vaporizer right here, and it's loaded through the top and you put your plant material in. But essentially what it is a small oven that you inhale through. And all the chemicals that I mentioned, THC, CBD, they all boil or produce steam at under 400 degrees. You set your little device for around 400 degrees, and you get this very light vapor with no smoke and no burning, okay? And this is the method we prefer for nausea. Why? Because inhalation route for nausea works in about 30 seconds, as where the oral route takes anywhere from about 30 minutes up to 120 minutes. Okay. So we like the inhalation method basically for this, since that's what's needed for nausea. We're working with local Rise Dispensary, and we have Office of Cannabis Management is giving us our blessing for this. This is just a picture of their location. Nice little room that they have to consult and talk with the pharmacist if they have any needs. So for anyone that's interested in getting their cannabis license, Wilmot has dedicated doctors. There's clinics, there's telehealth providers across New York State that are providing certification. It's a very quick process. Okay, if it's appropriate, your doctor then enters you into the program. Once you're entered, there's no waiting. It's immediate. Okay, so you literally get your digital certificate that day and can go to the dispensary that day. And they have gotten rid of the fee, so there's no fee. Okay, so obviously your insurance company won't cover your dispensary costs, but at least there's no fee and you can get lower costs with your medical license, and it's a pretty quick process. So summing up, what do we have actual evidence for cannabis? Well, the best evidence we have is for nausea and vomiting. We have good evidence for appetite stimulation for those folks who just can't eat. And there's definite evidence that sleep and somnolence is helped from cannabis use. There's some emerging evidence on pain, both general neuropathic, anxiety, and depression, but that's still in the developing stages. Biggest thing we know is that, it's generally safe with cancer therapy. Obviously, you want to work with your clinicians on this. But with the main therapies, we show it's safe to use alongside, and the treatment of your symptoms and side effects helps your outcomes in the end, in general. So as I mentioned, you have this vaporization. Um, that's what I would recommend. You don't really ever want to smoke anything, especially as a cancer patient. They also have the oil, the cartridges and the pens, but those don't have the entire spectrum of the cannabis agents that have in the flower. And as I mentioned, there's also the oral and edible products. Those work great. But you sort of have to match it. Like I said, nausea and appetite. You want something sort of fast acting. So our vaporization may be the best. Okay. You want to get your appetite up. You don't want to wait 90 minutes. You might want to try some vaporization, and then something longer lasting like chronic pain or sleep. An oral or an edible might be more suitable. And again, that's where there's the experts to talk with you. So again, I know we're going to be taking some questions at the end, and we'll save them up there. I just want to flash my info so everyone's got it, and then I'm going to pass the torch off to John right now. Let me end my share for you, John.
Thank you, Dr. Peppone. Let me bring mine up here. Just to get while I'm doing that, just to give everybody an idea. So my main job is in tobacco control, and where cannabis, marijuana comes in with tobacco control for us is we work on smoke-free policies, and very early on, in other states have shown this when the legalization of adult use cannabis is done by states. How does that affect already established smoke-free policies for different states? And Dr. Peppone touched on it when he mentioned that there's only certain places you can smoke cannabis or vape it anywhere that you can smoke tobacco. So if a municipality passes a law or housing authorities, apartment buildings pass smoke-free policies, they can actually limit not just tobacco use or vaping of nicotine, but also smoking of cannabis products, but also vaping of cannabis products. And just 2 years ago in New York State, all municipality owned parks was made smoke free of tobacco and cannabis. And municipalities would have to add vaping if they wanted to do that. And we'll talk about maybe why they should think about that. So I just wanted to really show the landscape across the country and where we're going. Most states have some form of legalized cannabis, either medicinal or adult use. In the prevention world, we do not like to use the term recreational. Gives young people the wrong idea when you use recreational, so we like to use adult use. And a lot of states have both. And honestly, what happened with the signing of the farm hemp bill, some of these states that had neither have kind of open themselves up to different products, which I'll talk about really quick. But as you can see, there's only a couple states now in our country that do not have either medicinal or adult use cannabis. So what is cannabis, hemp, marijuana? We hear all of these different terms. And I know Dr. Peppone did a timeline there to show you what's really gone on with cannabis. So how I break it down to people, because you talk about cannabis, or you talk about hemp, or you talk about marijuana. Cannabis, hemp, and marijuana really fall under the idea of what cannabis is. It's a plant with 500 chemical compounds, over hundreds of different cannabinoids, and that's where CBD and THC come in. They're cannabinoids. And with that farm hemp bill at the federal level, what it pretty much did was establish what cannabis plants can be considered hemp. And what that means is for a plant to be considered hemp, it has to have less than 0.3% of THC. So it can have high concentrations of CBD, low concentrations of THC. It's something to remember. And CBD is considered a psychoactive, just like THC. The thing is, it doesn't give you the euphoria. It's more, people use it more for a pain management thing. It doesn't give you that high like THC does. And then when we look on the other side of it, what we consider marijuana, which a lot of places and a lot of people do not like to use the term marijuana because it had a negative connotation previously. When we look at our Hispanic communities, that they used marijuana. Unfortunately, the term marijuana has been around for so long that when you're out in the community like I am and you use cannabis, it confuses a lot of people. So we most people still use the term marijuana just because it's the common term. And marijuana majority has THC, low CBD. So what are cannabinoids? Because I have people in the community tell me all the time, how can cannabis be bad for me when our body produces cannabinoids? And what you have to really explain to them, and I have this QR code so people can see where this comes from. So you have phytocannabinoids that are derived from plants, and then our body has endocannabinoids. And then I saw someone put in the chat about different cannabinoids and medical purposes. And we'll get into synthetic cannabinoids. And when you see a lot of these products now in some of the illicit shops, which I'll talk about, that contain Delta 8, Delta 10, HHC, THCA, THCV, THCO. A lot of these are synthetic cannabinoids. And then, so for states that have, like Texas, for example, they do not have legal adult use cannabis. But if you go into a gas station, you can buy Delta 8 and Delta 10 products. And what that comes from is the farm hemp bill. So what companies have done, they take CBD from hemp and then they chemically change it into other cannabinoids like Delta 8, Delta 10. So, when you hear people, one of the biggest arguments is, how can marijuana or how can cannabis be bad for us? It's natural. Well, a lot of these products, unfortunately, do not have natural cannabinoids in them. And we'll talk about that a little more. So there's actually a couple different types of marijuana. There's ruderalis, there's indica, sativa, and then there's hybrids. Usually when you talk to people, if you tell them that, I smoked a joint one time and it just put me to sleep. People's like, well, that's because you're using indica. People usually associate that where it relaxes you. And then sativa usually gives that euphoric feeling. They say it helps with creativity. Those are the two main plants. But you really have to look at cannabis almost like tomato plants anymore. It's very hard to find a plant that has not been changed somehow. And that's one of the reasons CBD products cost so much, because it takes so much plant matter to draw the CBD from. Because for the longest time, people were not looking for pain management when using cannabis products. They're looking for that high. I know Dr. Peppone talked about this medical stuff. Who can certify? So the definition of a practitioner in New York State, you have to be licensed. And then who qualifies? And he went over all of the different conditions people can have, which it's opened up immensely compared to where it first started. And we actually see in other states, even like Texas, that is, I don't want to bring politics in it, but they're a more conservative state. They have even themselves opened up the conditions for patients that fall under their medical cannabis license. And why, as Dr. Peppone has said, there are, even though cannabis is illegal, it's a Schedule I drug at the federal level, we have Marinol, we have Epidiolex that has been proven and FDA authorized to use. So we cannot, when we think of cannabis, we really have to open our mind that as studies come about in different things and we're able to do more research, there is a medical use for these plants and these different cannabinoids. And then Christine can share my PowerPoint. I have all these different links. The one thing I would recommend to a lot of people, the Office of Cannabis Management website really does have a lot of good resources for people to help explain stuff. And I've linked a lot of those in here. So when we get to medical cannabis, there's actually 3 different types right now. You have type 1, which is high THC, low CBD. You have type 2, which is 50-50. And Dr. Peppone showed the 2.5 milligrams of CBD with 2.5 milligrams of THC. And then you have type 3, which is high CBD, low THC. And so my grant's held at Roswell Park. So just like Dr. Peppone being at URMC, we're really lucky because there is a lot of good research that is happening. And they refer to her as the pot doc at Roswell. She did a presentation to the community, which was really good. we have this idea of cannabis being this miracle drug and cure, and it's not. She explains it's almost like other medications. You really have to find what's going to work specifically for you. Just because one works for another person doesn't mean it's going to have the desired effect for you. So there are different types. Dr. Peppone talked about the different types that are out there. He mentioned the 60-day supply now. Patients can grow free mature, free immature plants, or if they have a designated caregiver. So if a person has their medical license, but they are physically, or if they have a disability where they're unable to grow their own plants, they can actually have a designated caregiver. And that designated caregiver, same thing, you have to get licensed to be a caregiver. But they can have 2+ patients, and they can grow up to 6 mature and 6 immature plants. And I always questioned why so many plants, and how it was explained to me by one of the researchers at Roswell is, for one, our climate and weather is not the best for growing cannabis. So if you're growing 3 plants, if you get 1 or 1.5 plant yield, that would be enough cannabis for a person to use for the whole year. And Dr. Peppone mentioned that because of our weather, you might have mildew, you might have other issues with the plants. And I'll talk about, you really do not want patients smoking this plant matter that might have mildew or mold because of the effects it will have on them. And we'll also talk about some of the illicit stores, why that's an issue. Right now, we have 39 registered medical shops across New York State. 8 of them, though, are temporary closed. And what we've seen in other states, as adult use cannabis is legalized, we do see as medical stores do start to dwindle as adult use stores grow. One of the ways to tell if you're going into a store and it's a registered New York State store, you will see this placard in the window. Dr. Peppone mentioned the different ways to use cannabis and how it affects you. So inhalation is the fastest way, and we know that from people who smoke or people who vape nicotine. It can hit your brain within 10 seconds. It's very fast, which when it comes to nicotine and smoking, it's one of the reasons why it's also so addictive. But there's different durations of effects, onset of effects. So there's different, like you said, depending on why you're using the product, would probably dictate what product you do want to use because of how fast it affects or how long the effects will last. So real quick, rise in THC content. So I was one of those people during the opt-out period that Dr. Peppone talked about, was going to municipalities and was like doing presentations saying, you really need to opt out as a municipality right now. And the reason I was telling them to opt out, because during that opt-out period, there was no laws and no regulations established for retailers or consumption sites. So I was really explaining to these municipalities, if you do not opt out, you're really trusting Albany to get this right the first time. And I don't know, government usually doesn't get things right the first time in my short 44 years of life on this planet. The other thing is, when municipalities could opt out, they could always choose to opt in at any time. So if they did not opt out, and after December 31st of the year, when the Marijuana Regulation Tax Act, they did not get to opt out after that. So it was more of a safety valve for communities to opt out, wait and see what the laws and regulations were going to be. And if you thought it was a fit for your community, then you could opt in at any time. So the 60s and 80s, cannabis had a THC level of about 2%, all the way to the 90s even. You're looking at 4%. And then 2017, 17 to 28%. And now in the 2020s, you're looking at mid 30s, and that's for whole flower cannabis. Okay. Then we get into concentrates, though, and that's where you get into a bunch of issues, how these concentrates are made. I mean, they can be up to 95% THC. And if you look at places like Colorado, California, where they've had an established adult use cannabis market, concentrates are what people are buying. And I pretty much equate THC almost to like alcohol. When you see brew pubs and distilleries popping up, they're not making lower content alcohol drinks. They're making higher content alcohol drinks. And unfortunately, THC is the same way because our body builds up a natural tolerance to these substances. And then there has been some stuff out there, research there for, and this quote here is for these high level concentrates. There's absolutely no research that indicates this level of THC is beneficial for any medical condition. The purpose of these products is to produce a high, and the increased potency makes them potentially more dangerous and more likely to result in addiction. And that was one of the messages I brought about the opt-out. If you have a teenager who has never used it, has never exposed their body to THC, and they start with concentrates that are 90%, as they get older and they're building that tolerance, where are they going to have to go? You know, and what substances will they may possibly go on to get that same high. So then this just shows seized cannabis by the DEA, same thing, percentage of THC compared to CBD. So THC is on the rise, CBD has pretty much stayed the same across the board. Okay, Christine, thank you. Get rid of that. Come on. There we go. So adult use, you have to be 21 plus. Licensed marijuana products in New York should have no more than 10 milligrams of THC per serving size. We talked about smoking and vaping cannabis, banned wherever smoking, vaping, tobacco is banned. No marijuana use by the driver or passengers in a vehicle. And this is something people really need to get into their mind. Unlike alcohol, where 0.08 is the legal limit, there is none for THC right now. So the driver's deemed to be impaired or charged with DUI or DUI, same as alcohol or other drugs. For cannabis products, this is one of these labels for a licensed product, regulated product will have this on there. Same kind of placard for an adult use store. And I just wanted to show you some pictures. So I just bought this for my mom yesterday. She has RA, and CBD salve works for her hands. So we have a licensed New York shop here in Olean, New York, which is more CBD. I think it's 3-to-1 CBD compared to THC. You can see what the product looks like. It's got the label on it. The QR code, if you would scan that, actually takes you somewhere. So let's look at some illegal products. Oh, let's get through this. Can marijuana be addictive? Absolutely. Let me get through here. I want to show, this was a study that Roswell did really quick, looking at vaping of CBD. And what they found was vaping of CBD oil actually damaged the tissue of the lungs more than vaping nicotine. So they're looking at, the health effects. And as Dr. Peppone said, vaping oils is probably not the best option for people health-wise if they can do something else. So I just wanted to break on that. Gateway drug, you can tell for people right here, 12 to 17. Past month marijuana use compared to no marijuana use. So the blue is no marijuana use. The orange is marijuana use. And you can tell the issue if they have a prevalence of another drug. Okay, so that whole term of gateway drug, which it's not a bad term. You have to explain what it means to people when you're talking to them, though. People think that in New York State, if you test positive for THC, your employer can't fire you. Yes, they can, especially if you get in an accident at work. Workers' comp is not going to cover you if you're impaired by cannabis, just like if you showed up to work drunk. So real quick, unlicensed retailers. So, and Dr. Peppone mentioned this. With licensed retailers, unlicensed retailers, you do not know if those products are facing regulations or testing. They could contain harmful chemicals, metals. One of the easiest way to make concentrates from cannabis is to force butane through the plant matter, which strips the cannabinoids off, and then you have to you boil that liquid to get whatever butane that is left over. Okay. Flower products can have mold or mildew. I have heard from people at Roswell that they've had some cancer patients buying whole flower cannabis from retailers like on the Seneca Nation that have mold or mildew, and because they have a compromised immune system, have really had bad health effects from that. The majority of EVALI patients came from unregulated vape cartridges that contained vitamin E acetate. We could talk about the different THC products. Products not being labeled properly. They say they have this amount of THC in it. It's usually higher than that. Or products that say it's only CBD, and when they're tested, they actually have THC products in them. Real quick, here's some of the random products I've bought from unlicensed shops. So this green apple vape, it actually was sold to me that way. There was no packaging, and it was labeled as having THCO in it. And then you have all these mixture of products. So like this float, it's got THC in it and a mixture of mushrooms in the gummies. Weed Savers, 3,000 milligrams of HHC. Even this sucker down here that I bought, it's got 150 milligrams in that sucker. And remember, for a legal product, it's 10 milligrams per serving size. I don't know how many people don't think a sucker is a serving size. And then they even make K-cups with cannabis. I found look-alike Twix, different types of vapes. And then this bottom right, that is a concentrate. I would consider that crumble. Flavored as strawberry shortcake. The store I bought that for could not tell me the percentage of THC in it, which is really scary, or how it was made. And then with these illicit shops, you have to also worry about other products. Like these are all Kratom, or if you've seen anything about 7-OH products, they pretty much call it gas store heroin. I just bought these in our 2 illicit shops in Olean just yesterday. Okay. So a licensed cannabis retailer only sells cannabis. They don't sell alcohol, they don't sell, and they also do not sell nicotine vapes. They only sell cannabis that contains either THC or CBD, because all of the other cannabinoids are illegal in New York State right now. And just like Dr. Peppone, I'll give you my contact real quick before I unshare. I loved your Homer Simpson. I use the same thing with my dog. I tell people all the time, I do not have kids because I work in substances in our community. So I only have a dog, but most people think she's high in that photo maybe, or under some kind of impairment. So let me stop sharing.
Thank you both so much. I know that I learned a ton. This was a lot of information, and we have a ton of questions that are listed. So I want to just get started with that as soon as we can to try and get through as many as humanly possible. So if you know the answer, please jump in if you feel comfortable. So what is the difference? Okay, wait a minute. I will come back. Some of these I might have to look a little bit through.
Are you looking at the grow it and smoke it
versus cannabis? Yeah. Go ahead, John.
So when people say cannabis is natural, if they are growing it, right, and they're drying it and they're doing the process, like Dr. Peppone said, a lot of these products can have metal particulates in it, can have different fertilizers in it and different chemicals. So if you are growing it yourself, you know everything that is in that plant is the one thing I would say. I
What
don't
do
know
you
if you
think,
guys.
Dr. Luke?
Yeah, so so the way I interpret this question is like, what is like homegrown versus what you can buy in the store, perhaps? Is that maybe what I was on? No?
That
So
sounds reasonable to me.
yeah, I mean, look, so John mentioned we're in the era of very high percentage THC, right? So if you get a seed today, it's going to be a high percentage THC unless you specifically look for something. So the product that you grow can be very similar to the product that you find in the store. However, growing cannabis is an art form. It requires like you got to grow it. It's difficult. There are some more easier to grow, but once you're done growing it, like you have to dry it, but then you have to cure it, almost like a bourbon or something sits in a warehouse, right? It takes a couple months after it's a month after it's picked minimum, or else people tell me it tastes like a chlorophyll. It tastes like actual grass. So, you know, is terms you can grow a high quality product, but it takes a lot of work, a lot easier to go to the store.
The other thing I would say too, and we know this, if someone is smoking a joint or they're smoking a blunt, where they're opening a cigar, taking the tobacco out and filling it with dried cannabis, you do get carcinogens
Oh,
from the
yes.
cannabis plant. So I
Yes.
was really interested, Dr. Peppone. That's the first time I've seen the study on the vaporizing at that temperature. So
Yep.
I was really, that's very interesting to me. That's the first time I've seen that. But people need to realize that there are carcinogens and harmful chemicals from smoking marijuana, just like
Yes.
smoking dried tobacco.
Correct. Correct. Yes, the exact same. Anytime you light something on fire, you will create carcinogens, whether it's tobacco or cannabis. So, John, there is a paper published where they used the volcano vaporizer in patients and measured urinary carcinogens and found
Hmm.
basically none in them. So, I'm going to send that to you, okay?
Yeah, no, that would be perfect. I would
Yep.
appreciate that.
Yep. So Lou asked, are other cannabinoids showing usefulness for treatments besides THC and CBD? So I would say yes. But again, it's just getting to the very surface. CBN is something that researchers are very interested in sleep. And for night, it has a very sedating effect without like making you feel like you're on THC. So, there's and then CBN also has some potential pain properties. So I can tell you that there's research into all these cannabinoids, right? So yeah, it's hopefully going and hopefully will continue.
Okay, I'm going to jump around a little bit. This is a great question. What would you tell someone who could benefit from medical marijuana but is nervous about it being a gateway drug? So what would you talk with them about?
John, you want to go first?
So the one thing I would say is what type they'd have to figure out what type would work with them. If it's high THC, low CBD, is it a 50-50? Is it a high CBD, low THC? Is the one thing I would say. But here's the thing. Anything can become addictive and become an issue. I mean, look at the opioid crisis, right? So I think they have to be aware of their usage, and if they see it becoming an issue, the what was the other part of the question? There
This
was
part, like
you
opening
said
up the
about
gateway.
gate. Yeah, I mean, I drink coffee every day. If I don't have my caffeine, I get a headache because I didn't get my caffeine. I mean, they just have to be aware that it could be addictive and pay attention to
Mhm.
see if they're developing issues from it, just like alcohol, smoking, kratom, pain medication. Be aware. I think the one thing that's nice about licensed medical shops is you have a pharmacist that you can talk to. You have someone to talk to. I wouldn't recommend going on the internet for, options. Use that licensed practitioner.
All right, great answer. Let's see. Can you bring, oh, Dr. Peppone, this one I think is for you because you had mentioned that you can't bring marijuana, or not, it's not smart to bring marijuana across state lines, but if you have it for medical use, are you able to bring it with you like your other prescriptions?
So I believe the answer is no, but the good answer is that a lot of the medical marijuana states have reciprocal medical marijuana laws. So if you go from here to Arizona, I know in Arizona you can use your medical marijuana card, New York State medical marijuana card there without having to do anything else. So until the federal law changes, you will not be able to legal. Now, if you are driving, I don't see state police going to stop you, right? And you have a small personal amount, your risk is low, but that's up to each person. But just know that it's still against federal law.
The other hiccup that, since we're talking about federal law, for some people to try to get their medical card, which pushes them to use adult use cannabis, that for our areas, we're very rural. If you have your medical card, you cannot have a handgun permit. So for a lot of our people in rural areas that are hunters or like collecting guns, that is a barrier for some people when they find that out, which would push them to the adult use side of it, unfortunately.
Definitely. Definitely.
That is an excellent point that I
That's a great
never
point.
thought
Yeah.
about.
I found that out because of my mom with her RA. Her doctor, she lives in Pennsylvania. Her doctor recommended her getting her medical card. And I go, you better check the law. I think you have to give up your handgun permit. And that's, yes.
Wow. Okay, we'll do the one last question and then the additional questions that we don't get to, I will send out and hopefully be able to have John and Luke send some information back and I'll be able to put it into an email for you next week with some of these answers. But higher THC level, does that help more in taking away some of these symptoms?
No. So that's a great point, right? So if you go, so look, let's look at a little spectrum. Down here you have sober, and up here you have that graphic of Homer Simpson that I showed driving along. Okay. You want to get to a medicated area, which is somewhere right around here in this level right here. Okay. And that's going to help with pain, appetite, nausea, and vomiting, things like that. Best evidence we have, I just showed you that a 2.5 milligram CBD THC significantly reduced nausea. To compare that, the standard edible we give here is 5 milligrams, and that's pretty low, right? So those people, the majority of people taking 2.5 milligrams felt nothing, but still got symptom relief. So you don't want to go too high, you're going to have a bad time. You want to be in that middle, okay, that medicated area.
All right. So we're going to wrap it up. We're at 1 o'clock, but I want to thank both of our presenters again. This was an amazing webinar. I learned a ton. I'd like to thank our interpreters for making sure that this is accessible to our deaf community members.
Thank
Just want to
you.
remind everyone, please fill out the survey following the webinar to make sure we're providing content you would like. And if you'd like to receive continuing education credits, the survey is required. We will not be having a community conversation in October, but we will be having our CCAC retreat. So I encourage everyone to come and join us for that on October 17th. So thank you again for joining us, and we will see you next time.
Thanks, everybody.
Thank you.